Hope everyone's doing well. The first year, second term is pretty busy so far. I had the chance to attend the student dental conference back in the second week of January, where not only did I get to learn a lot more about just various things in dentistry like buying a practice, residency, but also had a chance to try some hands-on workshop too, such as the ones in the basic implants and the hands-on laser or introductory to laser workshop. So that was really cool. And also with school-wise and clinic-wise, we had a chance to dive more into learning about how to care for our patients. We had a chance to practice with performing history taking, intraoral, extraoral exams, and more is coming up too. So it's a little overwhelming, but it's good. I feel like I'm learning a lot. I'm trying to practice it all in order to get better at it and for it to come easier for me. So I guess without further ado, we'll just bring on the following clips. This is the workshop that I attended, and it's the basic implant workshop where we had the chance to install the fixture, which is the bottom part of the implant, on to be embedded in below the gum line. And later on, we even went on to screw on the abutment. And yeah, it was pretty cool. We didn't get to fit on the prosthesis, but overall, it was a great experience. First hands-on experience at the workshop that I really like. The second workshop that I attended was the basic intro to laser workshop, which was also equally interesting, and I'm very glad I signed up for this one too, because lasers are becoming a more prominent part and essential tool in dentistry going into the future. And this was the part where we got to have after the presentation, after we learned about the laser a little bit, we got to do a little bit of hands-on skills where we used the laser to cut into the sample pig's jaw. And yeah, it was nice to apply light pressure on this and see how the laser works. Oh yeah, and another important part at the end of the conference was the puppies. We had a visit with some therapy dogs and they were so cute. I have to put in a clip. On another note, not related to dental school, it started to snow and it stuck. So much snow. And I suppose dental school wouldn't be complete without a studying clip, and unfortunately I forgot to make a transition for that. So I hope that this will serve as a slight transition to one of the many studying sessions. So unfortunately I didn't get to record too much towards the end of January because I got sick later on, but yeah, so far it's a Sunday night and I am slowly recovering. So I am going to do some readings for our quiz tomorrow in class for this block, and some more further reading for the week ahead too. It's gonna be busy but good. Okay, it's me again. So after editing through this, I realized I forgot to talk about the clinic simulation work that we did. So I just wanted to throw that in briefly, that over January and, or since January and into the second week of February, we did our first diagnostic cast from our dental forum. We also performed the anterior crown prep and composite restoration from the prep that we did last term. So yeah, that was what we did so far. Just wanted to throw in a quick disclaimer too, that I didn't really have a lot of chance to film or videotape what I did in clinic because most of the time I am just rushing to get things done or to practice. So yeah, my apologies for the lack of videos, but I'm doing my best to have more of them. Okay, we'll keep the clips now. So this is me unboxing the Diagnostic cast that we had just gotten back marked from an instructor. So as you can tell, this is the maxillary one, and there is still a lot of work that I need to improve on this. Even though it's my third cast, there's still a lot of prominent air bubbles, and I still need to mix the alternate properly before I pour the stone in. Also, we did the bite registration too for our cast in order to guide our trimming process. So I realized that my toolbox is just a little unorganized as I was digging through it to find some other things. And this gave me some idea. If you guys ever want to see organize my toolbox with me video, that one can come up soon later too. But just kidding. My toolbox is not that exciting. There's a lot of unnecessary things in there. So these next clips are just of me realizing what a mess my toolbox contains, and just of me trying to organize and throw away unnecessary things like the extra cups we got from the dispensary. So this is the anterior crown prep on 2-1, and while the margins are still coming along, I would say that this is the first good hands-on experience with learning how to use the right equipment and the right techniques in order to produce each different sequential step to have the perfect prep to slide our indirect restoration material over. Working on our composite restoration today in Sim. So first we etch the surface and then adding on the adhesive later, and then putting in the composite and filling it up to restore the tooth to the original surface anatomy. And this is a comparison with the original 4-6, and still have a long way to go, but I'm hoping that practice makes perfect in this. I'm just getting ready for the clinic session and prepping my operatory on Friday morning right at 7 a.m. And yeah, so right now I am just cleaning and disinfecting. And today in the clinic sim, it should be pretty busy. We are going to be doing some work on preparation and restoration with composite. Unfortunately, I wasn't kidding about how I need to get organized. There's a lot of really stray teeth in my toolbox, and I had gotten a little organizer together, but the downside was that it doesn't fit in my toolbox. So yeah. And also a friendly reminder, don't forget to, when you're organizing your toolbox, tilt it against something stable, just in case it flips over and spills all your sim teeth on the floor. Not speaking from experience. This is just from a very messy session in the plaster lab. Like, don't do this to your spatula. It's such a pain, and the stone keeps coming off in your toolbox. What a rookie mistake.